If you've finished a run and your knee's hurting, or worse, you had to stop early, you're probably asking yourself, is this something I can run through or do I need to get it checked out? And let's be honest, the majority of runners don't want to stop running. And the advice online or on ChatGPT is either get it checked out or just rest till the pain goes. And neither of those are helpful when you're standing in the kitchen, dripping with sweat, stressed because your knee hurts, and you're trying to figure out what to do. So in this video, I'm going to go through 3 simple tests you can do at home to work out if it's something you can manage yourself or whether it's time to pick up the phone or get to A&E. I'm Aaron, a sports therapist, and I work with a lot of runners in my clinics going through knee pain every single day. And I've also had it myself, so I quite literally feel your pain. But before we go into the tests, I've put together a free online knee assessment tool, which you can get in the description below. Just head over to the link, answer a few questions, you'll get a knee pain recovery score, a few little tips, and it'll tell you whether your knee's irritated or if there might be some more significant damage that's gone on there and what you should do next. So head over to the link in the description below and give that a go. And as normal, I'll give you a little reminder at the end of the video. Now, here's the things a lot of runners don't realise. Knee pain isn't just a flick of a switch. It's not fine 1 minute and broken the next. I've explained it before as a bit of a bucket. So you've got a bucket that's got some water in. Each run adds a little bit of water and there's a little hole in the bottom that slowly drains out, and that's your recovery. So you're adding more water in through the runs, you stop running, and then that recovery drains the water out. But the more intense the runs and the more training you do and the worse the recovery is, the bucket fills up, overflows, and that's what's your knee pain. So you've essentially at the minute got a bucket that's overflown. But the most important thing to work out is, can you fix it yourself or is there something more serious going on? So we need to not just know, does it hurt? We need to know how it hurts, where it hurts, how long the pain's lasting. And that's exactly what these 3 tests are designed to work out. So test number 1 is the location test. Where exactly on your knee is it hurting? If your pain's at the front or around the kneecap and it feels a bit of a dull ache, especially if it comes on during or after running, then that's often patellofemoral pain, which is also known as runner's knee, as you might have heard before. It's really common, and in most cases, it's something you can work on yourself with a few exercises. If the pain's on the outside of the knee, especially if it comes on between 10 to 15 minutes into your run, then that could possibly be related to your IT band. And again, manageable with load management, the right exercises, and the right management at home. But, and this is one to pay attention to, if your pain's deep inside the knee joint, especially along the joint line, then that's a bit of a yellow flag. So it's not a reason to panic, but it's definitely something to pay attention to, especially if you've had any swelling. And that could be because it's a meniscus issue, which is the cartilage that keeps your bones protected between each other, or something else going on within the knee joint. So, quick location test, at the front of the knee or outside, probably manageable yourself at home. Deep within the joint, especially if swollen, probably worth getting assessed. Which brings us nicely onto test number 2. And test number 2 is the weight bearing test. And it's pretty straightforward. After you run, or the morning after, can you walk properly? Can you put weight on the leg that's injured? If you're limping, and I mean genuinely limping, not just walking a bit cautiously because you don't want to hurt it again, then that's a sign that your knee can't quite take the load that you're putting it through. And if that's just a step, then that's even more of a bit of a flag and a bit of a nudge at you to go and get checked out. If you can get up and down the stairs without grabbing onto the banister or the railing, then that's probably a good sign. So try this now. Stand on one leg. If your knee feels unstable or buckles, then that's another yellow flag waving above your head. Knees that give way need assessing. It's not something you can push through. It usually means there's something going on with the ligaments and they're not doing their job to keep everything nice and stable. So definitely worth going and getting checked out. And while we're on weight bearing, just have a look at the swelling. If it looks visibly puffy compared to the other one, or it feels warm to touch, there could potentially be some bruise in there, then that could be a sign that there's something going on within the knee joint. That's not necessarily something to panic about just yet, because a bit of swelling after a hard run isn't really rare and not necessarily something to panic about. But if it lasts between sort of 24 and 48 hours, then that is probably pushing it a bit towards another yellow flag. So that's probably a sign to go and get that checked out too. And if you can't fully straighten it or bend it, then that's probably orange pushing towards a red flag that you definitely need to go and get checked out. Because if you can't fully straighten the knee or bend the knee, then it's likely due to this swelling, but there could also be some sort of other damage in there, which is stopping that range of movement. So you definitely want to go and get that checked out. Now, test number 3 is what I call the 24-hour test. And this one is probably most useful for runners. And it helps you decide whether your pain is just general soreness from training or something a bit more severe. So here's how you do it. It's pretty simple. After you run, if you've got knee pain, make a note somewhere in your phone on a piece of paper, just of the pain score out of 10. So 10 being the worst pain you've ever had. You've had your leg chopped off. 0 being no pain at all. Just make a note of what you're feeling at the minute. So let's say it's a 4 out of 10. Then 24 hours, so this time tomorrow, do the same thing again. So let's say, for example, we're down to a 3 out of 10. The difference between those two numbers gives you a bit of a sign as to whether things are getting better or things potentially could have got worse. So let's say it's dropped significantly and you're now down to a 1 out of 10, or it might even have completely gone. So that's a complete green light. That's a sign that your body's done the right thing, it's healed, nothing serious is going on, or we can stop panicking. It could be normal tissue adaptation, your knee's coping with the load, it's recovering and it's doing what it's supposed to. But if that knee pain was a 4 out of 10 yesterday and it's still a 4 out of 10 the next day, 24 hours later, or if it's even got worse, then that's your knee going, I need some help, I can't cope with what you're making me do. And if we go back to the bucket, your bucket is overflowing, or it's right at the top and it's not draining down. Now, don't get me wrong, it doesn't automatically mean you need a doctor. Sometimes it might just mean you need to dial things back. You've been pushing it too far and your body's just like, nope, I don't like this anymore, calm down. It could just be you reduce your mileage, you start doing a few more easy runs instead of hard interval sessions, you cut a few hill runs out, or you just take a couple of days rest before you run again. But if that pattern keeps repeating over and over again, and the pain isn't responding to you reducing things and dialing things down, then that's when it's time to go and get a proper assessment, get someone to physically have a look, see what's going on. So let's put it all together. You've got 3 tests. If you're all good across all 3 green lights, pain around the front of the kneecap, around the outside, you can walk on it, you can balance all right, your knee's not giving way, 24 hours have passed and the pain's reduced. You're probably in the self-management territory, so you can deal with it yourself. Focus on load management, get it iced, try and just to calm everything down a little bit. Check your running form, you might need to do a bit of strength training to strengthen things up so it can cope with the load you're putting it through. All of which you can learn more about on my channel. So go and have a look at my other videos. If you've got 1 yellow flag, so deep joint pain, instability or swelling, you're struggling to weight bear, it doesn't settle down over 24 hours, then just get an assessment booked. Go and see somebody, speak to somebody who knows what they're talking about. The last thing you want to do is keep running, keep aggravating it, resting for a bit while it calms down, running again and aggravating things, and then you're 6 months down the line and you're getting really annoyed or it's got worse. Because hoping it's going to go away doesn't always happen. You're better off getting it assessed, knowing exactly what you're dealing with, and then you can manage it yourself if you need to. So hopefully that's helped and it's given you a bit of a nudge as to whether you can deal with it yourself or you need a bit more help. But if you are dealing with a bit of a niggle or any extent of knee pain, head over to the link in my description. That'll give you a recovery score. That in itself is a good sign as to whether you need some help or not, because if your knee recovery score is down at 10, then you might not. If it's up at 92, then you might be able to cope with it yourself. So give that a go. It'll only take 2 minutes, only ask you a few questions, and you'll get some free tips there that you can follow at home too. And if you want more advice and you want to learn a bit more about running and how you can avoid injuries and knee pain specifically, watch this video over here because YouTube thinks that it would be helpful to you. Thanks for watching and I'll see you in the next one.